general things about treating babies, these 6 topics that I find are very helpful to me, and the way we're going to think about what we're doing and how we're setting the scene. So, the first thing I just want to emphasize to everyone is babies are obviously very close to the source. The calmer you are, the calmer they will be, because I think it's everyone's fear to have a baby start to cry and then you won't get anything done. And what does that look like in front of the parents? And what is that going to feel like for you? To be honest, it doesn't happen that much if you do some of the following things. First of all, you do have to tell yourself to just stay calm. I'm going to stay calm. I'm going to take the pressure off myself, and I'm going to maintain the energy in the room, because that's the way you're going to get some really good results. But practically, how am I going to do that? Well, number one, when I start my day, I leave my problems at the door or on an imaginary shelf. I can recognize that I have them. I can recognize the stresses in my life, and that's okay. But I put them away because I can pick them back up later on. And I try to reset right at the start of the day. And then between patients, you want to refresh your energy and reset. And a simple way to do that is to, if you have very little time, at least wash your hands, which we should do a lot with babies anyway, and take 3 breaths. If the next group has to wait for you for 1 more minute, just take that time, because time saved at the beginning to do that saves you time later on. So that's this first point we're looking at right here. Speaking of time, we want to book enough of it. And I get asked a lot, what should I book? What kind of time should I book? I always book 1 hour for a new baby start. And that's because, you want to do a really good intake form and intake process and learn some details about the family and the birth. And it doesn't mean you're going to minutia, but you just want to not feel rushed and you want to hear their story. And you want enough time to get a feel for what you're going to end up doing and really just worry about the rest later on. So get a picture, feel around, give the baby a lot of breaks. Sometimes they need to have a diaper change or feed, and then you feel zero stress. So for follow-ups though, I definitely book 30 to 45 minutes. So on like paper, what the patients see, it's a 30-minute booking, but I book a 15-minute break after a follow-up. Again, because I want to reset myself. There's just no way that I want to grab another patient, adult or a child, and have them in immediately after treating a baby. You got to reset the room. You got to wipe off the table, all that stuff.